everyone, and thank you for joining Canceling COVID, a place for real talk and real solutions as we stay safe in the middle of the COVID-19 pandemic. We're all aware that the Delta variant now has created quite a spike, and we're seeing numbers that are exceeding what we had before. So let's first thank our sponsors, Mecklenburg County Public Health, mecnc.gov, mecnc.gov. They are available to answer any of the questions that you may have. And I think that's a great option for you. Instead of just asking anyone, go to the professionals, 980-314-9400, 980-314-9400. Also, thank you to Groundwater Solutions for supporting us, Dr. Tracia Black and her entire team. They do an amazing job out and about in the community. Now, the COVID spike continues to put more lives in danger. Right now, we're seeing numbers that, well, we haven't seen, as I said before, since the end of January. More than 3,500 people are being treated for the virus in North Carolina's hospitals. And, this is really starting to take a toll, not just on us as a community, but the healthcare workers. Salute to anyone out there in the healthcare field that continues to just press on and push through this. Prayers for you. And we just want to continue to say how much we appreciate all that you're doing. Right now, 25% of those 3,500 in the hospitals, they are in ICU. And so they're in intensive care. And 15% are on ventilators. And a lot of our young people are being impacted right now, folks. And you got to think about the effects that they'll have even long term. So we really, really can't express it enough. Just trying to do our part here, bringing on individuals to kind of uplift and encourage and just share information, which is what you should be seeking to do when you're trying to make these decisions. I know the whole controversy around it, but we don't have to play into the division or the divisiveness of it. Just find out what you need to know, what questions you may have, and then make your decision from there. I will continue to say, though, it's not just about you. It's about your neighbor. It's about your family members. It's about others that you are around. So just keep all that in mind. Now, one of the things the pandemic has really shaken up, of course, is our work and home life. And a lot of people are getting ready to head back to the workforce. Thought we had turned the corner, and it's like not yet. So more people than ever are working remotely. Others are pivoting and starting their own business. Some people are just starting another career, period, not as an entrepreneur, but just going in another direction. I hear it over and over and over. I've never seen so many people, so many places that are hiring. A friend of mine that owns a restaurant, he called me totally exhausted last week. He said, I need help. I have no one. And one of the things that a lot of businesses are doing, and I suggested to him, you're going to have to change your business model. You're going to have to look at other ways to bring in good employees because there's sign-on bonuses now, all type of creative ideas to get people to come to work, and not to mention increasing the pay. So either case, sometimes it's hard to just find time to complete the never-ending to-do list, meaning if you decide to own your own business and become an entrepreneur or have to pivot, sometimes it's just very difficult to hold it all together. And so I want to talk to our guest. Her name is LuAnn Barry. She's the owner of Spice Lab. It's a project management and business consultant firm right here in the city. And first of all, good afternoon, Ms. Barry. Thank you so much for taking the time to talk with us.
Good afternoon. Thank you so much for having me.
Absolutely. So a lot of people are just kind of at a crossroads. They've been like kicked into this whole situation. Do I go back to work? Do I stay home? Do I start my own business? Do I just start another career? Do I go and just learn another career? So much happening. And now you got the element of children back in school. Some of them are not going because parents are not comfortable. So there's so much that goes into that. So you know all about stepping out on faith and starting a business. Tell us about how you managed to do that.
Indeed. It's never easy. And, as a single mom of two little ones,
Oh, wow.
it was pivot just seemed to happen all the time. And as much
Mhm.
as you try to plan for certain things, because as a project manager, I'm always about a plan. You never know about the elements. And so the one thing I have to say is you have to understand along the journey? What is the motivating factors? What is the thing that is going to continue to help keep you motivated to get through to the next, right?
Mhm.
And not being afraid to embrace the change. change is inevitable.
Yes, it is.
Right? It's just a matter of when is it going to happen. So the world has a universal was put on universal timeout, and
Mhm.
it's like, okay, what are we doing with this timeout? And even then, when everybody thought, okay, the world's opening back up, we're dealt
Right.
a blow. So it's what are you going to do in the pivot? And so for me, it really amplified what do I want and how do I want to move forward in this pivot, in this time of change. And a lot of things that came to the top thing that revealed itself was like my mental health. Just how
Mhm.
do I get by? How do we survive? Having a strong circle of people, I think, is very important. And for those that don't have that circle, look to create it because we all need a shoulder to lean on from time to time, no matter how strong you are.
Absolutely, and we talk a lot about mental fitness on here as well and bring on experts, but, the pandemic talk about mental, health, a
Mm.
near immediate effect on women's employment. It's like, we take another hit. 1 in 4 women are considering leaving the workforce or even downshifting their careers. Working moms, women in senior management, and Black women seem to be having the most challenges, according to new reports. What are you seeing in your role?
Well, listen, as a minority, living it and have lived it, I have to say, we as women, we have historically we've had to make life altering decisions, regardless if
Right,
we wanted to or not, and usually for the betterment of others, right?
right,
And so I think from me, what I'm seeing on my perspective is that even though we know inherently we're in that position where we will make those changes, it now becomes what do we want? What are we getting out of this? Like we're not only doing it for ourselves. I'm just, women of color, just what is it that we want, right? Because if we are going to be making these changes that people expect of us to
right.
make, what are we going to get out of it anymore? We're no longer willing to sacrifice everything with nothing to gain from it. And so I think that's with a lot of the conversations that I'm seeing with women
Mhm.
that I speak with in my circle, people that I come in contact with, just, how are they adjusting? And how is it that they are now putting themselves a little bit more to the forefront and not so much to the back?
And good for them. So when it comes to Spice Lab, what do you do to help women or somebody trying to make a career transition?
Um, Here at Spice Lab, the number one thing is what is your vision? What is
Mhm.
the vision that you have? Own it. Because that's the other thing, right? It's like dream big and then dream bigger.
Yeah.
But what is the vision you have? A lot of people run from that. Like you
Yeah.
just you stay in a space of envisioning where it's just up here. But in order to really put it into motion, you got to make it real. So, what is your vision? And so that's what I help a lot of women do, and small business owners, particularly. First, to own your vision, own what it is, and then really to be more specific, right? You got to be strategic. So,
Right.
in order to do that, you can't be all over the place. What is the objective? What do you want to see? And then, how do we align all of that together? And so, I use project management to help make that come to fruition.
You mentioned project management a lot. So some people may not be familiar with that term or it might confuse them because when I started thinking about project management, I started thinking about these big jobs in corporate America that someone has to lead up. So, is that about just what corporations need, or is this something anyone can use to balance their day, their day-to-day life?
Anybody can use project management. Listen, I am a living, breathing, walking model of project managing everything, right? But I like to use the example of a surprise birthday party. If you're dating and you want to give a romantic evening and surprise the person, any surprise still needs to be planned, right? So that
Right.
is project management.
Oh,
You identify something, you come up with a plan, you find the resources, meaning who else is going to help you pull it off. You execute, and then you stand back, as we would say, monitor and control, but you're looking to see what's the reaction. Did it go well? This is all project management. We use it, but just never know the term.
and
It
definitely
is
didn't call
not.
it that.
No,
Yeah.
absolutely not. It is not for corporations. We use it all the time.
Oh, wow. Your energy is contagious. I really appreciate that. So, what is the biggest advice you may have for remote workers or small business owners that are trying to navigate this pandemic? Because there's just so much. And obviously, well, I would think people understand they can't eat the whole apple right away. You kind of got to just keep chipping away at whatever you're trying to do.
I would say remember that darkness and in moments of darkness and uncertainty, there's always light at the end, right?
Yeah.
And we are not running a race. We are running a marathon. So take your time, but be intentional, right? Be intentional on the impact, be intentional about what it is that you want. And I think that's the best advice I could give anybody, but to own it, right? To move in the spirit of I own this, this is what I want. How do I make it happen?
Oh, great, great stuff. As we wrap up with everyone, it's Miss LuAnn Berry, a great conversation, owner of Spice Lab, a project management and business consultant firm here in the city. I love spice. I love that word. Everybody needs a little spice in their life. So,
Indeed.
any final thoughts as we wrap things up with you?
Now is the time, right? We can no longer live in a space of shoulda, woulda, coulda. I think COVID has showed us that now is the time to really live our fullest and truest lives and to really own it and to do what we need to do for our own peace of mind, but also to live better and fuller lives.
Well, thank you for that and great advice because regardless, a pandemic or no pandemic, time stands still for no one.
No one.
So you better figure this thing out and come on, we just hold it together. So thank you again, Ms. LuAnn Berry,
Thank you for
owner of
having me.
Spice Lab. I really appreciate you taking the time to talk with us, and thanks for great information on this Friday. We continue to bring you information here on canceling COVID. What a lovely conversation and a great person to share some advice and wisdom. I don't know, LuAnn, looks like you're still up. Do you have information if people want to get in touch with you?
Sure. So I say Instagram is the quickest way, Spice Lab, SPICELAB, or you can feel free to email me at info@spicelabmedia.com.
Great, great stuff. So thank you so much. Amelia is still working behind the scenes. We want to talk about the COVID spike again, a new treatment center here in the city that's going to work to take some of the strain off of local hospitals. We've got another conversation coming up. I think she's trying to get them on. There we go. Another conversation that's going to, we had someone log on just a little bit late, but all the same, we're glad that he is here. Absolutely. A much needed conversation because I'm interested in finding out more about this new treatment center that we've got in Charlotte. It's going to take some of the strain off of the local hospital. So, Dr. Michael Estramonte, is that how I pronounce it?
You nailed it.
Oh, good
Fine.
deal. You're the CEO of Starmed Healthcare, and we're hearing so much about you. So thank you so much for joining us, especially Starmed and the work that you're doing in the community. So it's the first non-hospital system in the area, and you guys are administering free antibody therapy at a new clinic on Wendover Road, and it's at the Eastland site. So tell us more about this treatment and who benefits from it.
Certainly. First, I want to make sure I make mention of all of our team, our staff at the vaccines and testing sites working out in 90 to 100-degree weather. I just want to make sure I just give them a shout out because they are just working incredibly hard for the community right now. So, yeah, no, certainly the RegenCove, the monoclonal antibody therapy clinics that it was about 3 weeks ago, we started to see that the supply of this was starting to be to the point where it wasn't just going to be available to hospital settings and that it could potentially be used as a preventative measure to keep people from getting into the hospital or for the higher risk individuals. So to get a proof of concept, we used one of our existing sites, only had 4 or 5 rooms in it. And we built out some processes and workflows to be able to utilize that space to open up the appointments book to administer this therapy. And that was over on Central Avenue. So we're excited. We have a 4,000 square foot space here on Wendover that we're opening up on Monday. They're still behind me, putting the exam rooms together. It'll be fantastic. There's plenty of space here, and yeah, we're looking forward to expanding this because as of right now, we can see 48 patients a day, and we're already at capacity with that number. So it's there's definitely a demand there for this.
So there are 2 locations, one on Wendover and the other one off of Central, which is the old Eastland Mall site, which most people will recognize. Now, for me, the question is this kind of the same or similar type of treatment that was announced in Florida that would start to be offered as well?
No, that's exactly that.
Okay.
They rolled that out in Florida. They might have done it a little bit too quickly, but
Yeah.
the thought process was correct. So no, it's the same. It's the same thing.
Well, we've got some people hopping on. We've got loyal viewers that also hop on. And again, thank you for talking to us, because this is good, great information for people to find out. And Erica Simonton Beatty's already said great information. And Travis Riven said, live it, own it, great advice. That was for the first guest. But I want to ask you, so what patients, who would typically see or come by and look for this treatment, and how quickly will they get results?
Well, yeah, like I said, initially it was reserved for individuals that are already in the hospital, but at this point, it's been approved for not only unvaccinated but vaccinated individuals that have had a case. You can have. It's also reserved for some people that are high risk exposure, that are eligible for it as well. There are some limitations if you've gotten to the point where your symptoms are too severe. It doesn't matter whether you're here in a clinical setting or at the hospital. There are limitations to when REGEN-COV or the monoclonal antibody therapy can be administered.
So now this is, so that people aren't confused, is this a replacement for vaccines?
No, absolutely not. And I'm glad you asked that, Tanya, because that's an important clarification. The vaccines, they create a different type of immunological response that involves your T cells and your B cells. These antibodies are antibodies that were produced from an individual that had already had a past COVID infection. They take their natural antibody response, they replicate it. And once it's replicated, then they can use those replicated antibodies to fight COVID in a new patient with a new infection.
Wow, there's science at work, and it sounds all intricate and detailed.
Now,
You gotta respect that.
and this isn't new. This has been around for decades. The use of monoclonal antibody therapy it's not a breakthrough technology.
So you guys working with the hospitals are really strained right now. And at the top of the show, I talked about our healthcare workers. And yeah, shout out to Starmed. They are keeping quite busy. And our hospitals, so many of these guys are really feeling it yet again. Thought we had turned the corner, and you got to pray for their health, their mental fitness. But what is the plan on how you all are able to assist hospitals because they're so strained?
Sure. That's the one thing about Starmed. We're a smaller organization. Obviously, we can move a little more quickly and to assist the hospitals, because the hospitals are doing a magnificent job. And we just can't, here in Charlotte, Novi Nature, we can't give them enough credit for what the doctors and nurses are doing there. And if we can play a small part in keeping people out of the hospital, Starmed will do whatever it takes to assist in that role.
Well, I ride by your location on Freedom Drive from time to time, and I noticed yesterday quite a line over there out there in the 90-degree heat. So you guys are putting the work in, and I know it's very tough. Are there other plans to expand to other counties, this plan that you have? I know Starmed has a couple locations here in the city. You guys are all around the state as well?
So yeah, through the state, we perform testing and vaccines. And as of right now, we've had multiple counties, I think anywhere from 6, 7, or 8 different counties have noticed what we're already doing in Mecklenburg and asked us if we can set it up. So we're very soon we'll actually be in Gaston, I believe. We're actually all the way out in Onslow, Bladen County. So wow. It's as the demand comes, we're being very mindful to make sure that we scale properly and do this so the patient experience doesn't suffer while weighing at the same time that if this is going to be a therapy that keeps people out of the hospital, we need to do it as quickly as possible.
So the expansion would be for the regular vaccine and testing, or the new treatment centers, or both?
Really, I mean, it's all of the above. The demand there, and we've talked to our team across the state at this point. The testing demand is up. The vaccine demand is up, and now with REGEN-COV, we're like I said, we're trying to build this out as methodically and responsibly as possible to make sure that we're doing it correctly.
And doctor, you kind of mentioned it earlier, but would you describe this antibody service? It's not new, but the fact that it's being implemented now, would you say it's a game changer? And if so, why?
It potentially could be. Like I said, it's not a substitution for the vaccine whatsoever. But if we get to the point, especially in this late fall when it's cold and flu season, and the situation, I mean, from what I understand, the hospitals, the ICUs, a lot of them are at capacity. And if August is any indication of what this could become, I do think this is something that we need to look at seriously.
Well, I certainly appreciate you taking the time to talk with us. If there's anything you would like to leave with our viewers, our listeners, again, Dr. Michael Estramonte of StarMed, I
Mhm.
just appreciate you again taking the time to talk with us.
No.
Anything that you would like to share?
Not just I did see it scroll across the screen that had our phone number. Our
Yeah.
call center it keeps growing day by day. But the best way, if you need to make an appointment for anything, testing, vaccine, or even the RegenCove, is to go to starmed.care, and that's and there's tons of information on there as to where our locations are, et cetera. But Tanya, thank you for taking the time to allow me to get this information out there to the public.
Absolutely. And I want to say thank you and even a plug because when we did testing, my son and I, we went to StarMed and I had a question and customer service was on point. So you guys are doing something right. I really appreciate that. And you coming to talk to us speaks volumes about your commitment. So thank you again for taking the time to talk with us.
Thank you, Tanya.
Absolutely. So great stuff again as we pass along to you. That's what we work really hard to do, canceling COVID, real talk, and of course, information that you can use to share with others. And I say this every time we're on. Some people can't hop on at 1 o'clock. So please hit the share button right where you are right now. We see a lot of the loyal viewers and listeners hopping on, but I really, really would love for you to share more. We've got some great conversations. Hats off to our producer who gets these really good guests to come on. And that's what I will continue to say. You hear Dr. Tracia Black and I talk about it all the time. It's about these grassroots movements. If everything you've tried is still not moving the needle, let's try something different. And I think just bringing it straight and direct to the people. Dr. Jacobs on Wednesday agreed with that. You've got to do these one-on-ones and you've got to have these conversations. And shout out to StarMed for providing Dr. Estramonte on. He's the CEO, guys, who is taking time to talk. StarMed Healthcare. So grateful for that. Okay, our kids are back in school, of course, and in other news, there are 8 schools that have clusters of COVID-19 in the Charlotte area, and school started on Wednesday. Oh, I'm praying and hoping that we can continue to work together to get this thing under control. We really, really need to, because, it's going to be football season, and who does not want to go to a football game? Come on, people, we got to think about others. So I heard a comment from one of the school board members saying, I saw a game and I saw all the fans in the stands and they were packed in there and they didn't have masks on. Come on, people, we have got to figure this thing out. Football season, everyone. We had to make so many sacrifices last year. I just don't want to do it again. So Union Academy right now, they have the state's largest cluster with 101 cases. And of course, that started early on. There's a cluster, just to explain that, a cluster is considered more than 5 cases. But we also know how this disease continues. It seems like it just walks up to others and just hop on, and take on a whole nother life. So Union Academy with 101 cases, 19 students and 1 employee have already tested positive at Bradford Prep right here in the city in Charlotte. And Independence High School, they've got 11 cases. Audrey Kell has 5. So what we need to do is what role and what are you doing to make sure this isn't happening? There are also COVID clusters at Ashbrook High in Gaston County. You heard Dr. Estramonte talking about Gaston County. They'll be moving in that area. Also, Lake Norman High, that's out in Mooresville, not to be confused with Lake Norman Charter, Cabarrus Charter Academy, and Cannon School in Concord. So you see on that list, some of those are private schools, but my experience was I thought a lot of those private schools this year required masks. I know the charter school I was in contact with, as well as the private, they required masks, but who knows? The mask mandate left up to the individual schools to decide where do you come down on the side of caution with that. Anyways, we do know that masks work. We've seen a drop in deaths when people did get vaccinated. We know that personal hygiene, as far as sanitizer and washing your hands, all those things did help us come out, and hopefully we can do it again. The physical distancing part, I've seen that going out the window. I guess we're just the people that just want to love on and be upon each other. But it's time for me to move out of the way. Some great conversations today, and I'm so grateful for that. Grateful for the energy and the information from LuAnn Berry. She was absolutely great and encouraging. Spice Lab, a project management and business consultant firm. And also thank you to Dr. Michael Estramonte of Starmed and all the information that he provided. That's Starmed Health. Looks like my producer is rushing me off. I thought I had about 4 minutes, but it's time to move out of the way. My Praise in the Park event, folks, is still happening right now, September 18th. So we got to get it together and keep it together. As always, life's challenges make you better, not bitter. I'm Tanya Rivens. Join me Sunday, 7 a.m., Sounds of Inspiration. I'll be there, 103.3, 100.5 FM. Have a great Friday. Try to stay cool and hydrated. And remember, together, we will cancel COVID. Thanks, everyone. Have a great weekend.